One self-confidence issue I have, I guess. It's just always been that way growing up, now especially when you get older.
Candace never had braces. Now, as an adult, she's acutely aware of her smile and believes people stare at her teeth the second she opens her mouth.
Well, everybody has that one thing that bothers them about themselves, and that's mine.
Photos capture what Candace describes as a lifetime of insecurity.
I guess I smile less than I would typically. If you tell me, say cheese, I'm going to come off with this silly grin.
So now she literally counts the days until she can visit the dentist.
I'll have to try to
In this
blend
case, the
everything
dentist is
in
Dr.
so that
Ronald
it's
Goldstein, considered the father of cosmetic dentistry. Dr. Goldstein leads an elite team of aesthetic dental specialists in Atlanta.
Right.
He says a smile makeover doesn't have to be expensive if you do your homework.
A little bit.
There's always something that can be done, and many times it's economical. It may be anywhere from just bleaching of teeth to make them look whiter. Cosmetic contouring is the least expensive, one of the least expensive things that we can do, and that's reshaping of the teeth to give them better, an illusion of straightness sometimes, but to make them look better.
Okay, I need you to open real wide for me.
Dr. Goldstein encourages Candace to invest in braces in the future, a treatment that typically would cost between $3,000 and $7,000 and yields permanent results. But right now, Candace isn't interested in an orthodontic solution. So she turns to Dr. Goldstein for cosmetic enhancement.
Get her, I think, the right smile, and a smile that looks good, and I think you're going to see a big difference in her as a person.
I think either 1-in-1 or A1 are good.
Dr. Goldstein recommends custom-designed porcelain veneers, which are secured over natural teeth. The procedure ranges in price from $800 to $2,500 per tooth, depending on your dental needs and where you live.
And one is very nice too. Yeah.
From the initial exam to placement of the veneers, the entire process normally takes a couple of weeks.
The wax up.
Because there are many ways to approach Candace's case, Dr. Goldstein begins by listening.
I know that you're here for improving your smile, but Candace, I'd like you to tell me in your own words what you don't like about yourself, and I'm going to give you a mirror. Let you take a look.
Definitely the space. Seems like they're a little discolored and jagged. And the missing teeth when you do the big smile.
Do you try not to smile?
I try not to smile, but it's definitely tough.
We're going to do some diagnostic procedures because first I want to make sure your mouth is healthy.
Dr. Goldstein and his staff use a technology called digital radiography to take full mouth images of Candace's teeth. Unlike traditional x-rays, digital radiography allows Dr. Goldstein to manipulate the pictures and magnify the images for closer examination.
Essentially, I'm seeing the fact that there is a problem, I believe, in the thickness of the enamel here, and I think there's some defects.
In addition to identifying potential trouble spots, digital x-rays reduce radiation exposure by 90% compared to traditional x-rays.
Aha, that looks suspicious right in there.
The intraoral camera reveals a potentially devastating problem.
It looks like it's starting to leak right from the sides, and if you note, there's a fracture right in between the teeth. There's a crack there.
Dr. Goldstein then uses a hard tissue laser to prep Candace's cavity for restoration.
Close all the way again and open up.
Satisfied with Candace's overall oral health, Dr. Goldstein uses technology to help design her new smile.
What I see is we filled out the area here.
The technology is called computer imaging. This type of imaging allows patients to see results before work begins. Dr. Goldstein says the technology is critical to ensure success.
It allows us to be predictable, that I like the result, my team like the result, and the patient will like the result.
With the image approved, Dr. Goldstein goes to work.
I'm going to help reshape these teeth and make them look prettier.
Dr. Goldstein uses a tool called an ET diamond handpiece, one of his own inventions, to painlessly shape Candace's lower teeth. Simple contouring makes Candace's lower teeth look like they just came out of braces.
All right, we're going to take an impression now.
Dr. Goldstein will fit the upper teeth with ceramic laminate veneers. After studying a series of exact molds of Candace's teeth, Pinka Sadar, a ceramic specialist, crafts individual porcelain shells to fit precisely onto the faces of Candace's natural teeth. While the veneers are thin and brittle, they will become very strong when bonded to the underlying tooth.
Let me see what we're getting in the picture here.
Day 2, and Candace is back in the chair.
No.
But at the end of this day, she'll leave a changed woman.
All right, Candace, today's your day.
Because of the haphazard position of Candace's existing teeth, the Goldstein team creates veneers that not only cover teeth, but fill existing gaps.
I'm ready.
Placement is a tedious process. As the hours pass, the pieces of the puzzle begin to fall into place. But in cosmetic dentistry, the final piece is often the most difficult to place. Candace's case is no exception. She suffers from a unique hereditary disorder. When she lost a baby tooth, a permanent tooth never grew in, leaving a large gap. Now, Dr. Goldstein attempts to place a bridge to fill the hole. Once the veneers are secure, it becomes more about artistry than technology. Dr. Goldstein, a true perfectionist, admits he could fine-tune forever.
I once worked on a patient with one crown for 1 year. I did it over and over trying to get the ultimate perfection. So sometimes we don't know when to quit. But I, as an artist, always try to do something better. So I know you have to stop sooner or later, but I try to get everything I can out of it, and then I'll bring a patient back and look at it again.
Take a look.
Right now?
You don't have to.
No, I want to.
Then look. 1, 2, 3.
Oh, my.
Looks so beautiful.
Big smile.
How they look?
I never thought my teeth would look like that.
You know, when you have a slight smile and then more.
Candace is moved by the transformation.
Oh, wow. You look gorgeous. You look beautiful.
I was emotional too. Yeah. It's why you do what you do. I mean, you don't do it for the money involved. You have to love what you're doing. And when you see someone that is affected like that, and you realize not that it looks good or she likes it, what you realize is what it can mean in the future for her. You change your smile, change your life.
While some dental patients may
in detail. Okay, but the fact that there's not many teeth there, I get made fun of all the time. And if I just had teeth, then maybe I'd think that people could see the real me instead of, well, the me without teeth, I guess. When I had braces, I have cement left over on my front teeth. I had braces for 5 years. Let me think. Just my chin. I feel that my face is really, really small, and my teeth are really, really small, and it looks like I don't have any on my bottom. And people ask me, like, do you get into fights? And I was like, no, I just was born without 12 teeth, you know. And so that happens all the time. And then I guess I just wish that I'd be normal and have teeth and can smile, like, where everybody can see that I have a great smile, I have a perfect personality, hopefully, and then that people could just see the real me. Well, I want to go back into modeling and singing, and I would like to be a motivational speaker for the people in abusive situations, like children mostly. I'm going to major in Spanish, speaking the language, and that way I can do it in Mexico and in different countries that speak Spanish. That way I have the American and Spanish community, I guess you could say, being able to listen, and for me to be heard all over the world, I guess you could say.
Big
Well, I feel absolutely wonderful, and I cannot stress and express my gratitude with words how I feel about everything and the progress and everything that we have as a team have accomplished. And I think that, you know, like I said, I can't express it. It's amazing what we've done, and what you have done is just amazing. And I mean, I don't only see a drastic change in my physical appearance, but in the way I think and look at things, and the way I feel about myself, and my self-confidence is just beaming and skyrocketing through the roof, and that is a great feeling. I'm not getting made fun of as much, and I've actually got a boyfriend now, and that I didn't really have anybody say, "Brittany, you have a great smile," and I get that all the time now, not from family and friends, but from people I don't even know. I get compliments, and I never had that, and I do now, and that also is a great feeling. And the braces, of course, they're not my favorite part of the procedure, but I mean, I can live with it, and anything that is thrown at me, I'm going to take it with full force and try my very hardest to, you know, accept and make the best of it, and that's what I'm trying to do now, and just keep them on and not break any. This is my goal, but I just am in awe. I'm in awe about the improving everyday type thing. It's just different. I wake up in the morning and I see myself and I still think I'm dreaming, and I have teeth and I didn't before. So.
Congratulations, you went through your first phase of treatment with getting your teeth put in the right position with orthodontics. How have you been feeling?
Wonderful.
Yeah? Okay. Looks a little bit better?
Oh, definitely.
Yeah? You feeling a little bit better about yourself?
Very much, yeah.
Okay. Well, let's take a look. Remember when we started, Brittany was missing some baby teeth. She was missing some permanent, actually, teeth in the areas of the lateral incisors, number 7 and 10, and also in the lower lateral, the area of number 26. So we put teeth on the arch wire. And you assisted me in doing the orthodontics by doing these temporary bondings in the posterior to help us open up the vertical dimension, so we were able to give it a little bit more length, some more support. We were also able to get a lot of width. We expanded her out in her arches, and I think we got some good width. Bite down. You can see we're very, very close now to achieving a good centric bite for her for the first time. So what we'd like to do today, now that we've gotten the right spacing, is to take the braces off and get her ready for the restorative phase.
Excellent.
Go.
What did you just say?
Dissolve.
Okay, I think you fixed it, but I'll keep an eye on it. Thank you so much.
I'll go past that first touch, go to the first touch, because I think it's collapsing a little bit. I'm going to have to open her back up a bit, just a bit. 2. All right, next step is going to be we'll put an Essex in, which will replace those missing spaces. And
Oh, they look wonderful! Wonderful!
Don't they look beautiful?
Oh, love it! You just look so pretty. Oh, you guys did so
Good. She is. Look at her.
beautiful! So pretty,